If your doctor just told you your blood pressure needs to be 120/80 and you're over 60, that perfect number could be dangerous. Not protective like you'd think, actually dangerous. I'm talking about dizziness when you stand, falls that fracture hips, brain fog that everyone blames on aging, even increased risk of death. For 30 years, I pushed that 120/80 target on everyone who came through my emergency department. Then, I started noticing a pattern. The seniors with textbook perfect blood pressure kept coming back, and the ones with slightly higher numbers, they were thriving. This isn't about ignoring high blood pressure. It's about understanding that after age 60, your body's needs fundamentally change, and the blood pressure target that protects a 45-year-old might be slowly destroying a 55-year-old. Here's what nobody tells you. The guidelines changed, but not because of new science. They changed because of committee decisions. And those decisions didn't account for what I see in the ER every single shift. I'm Dr. Alex Hayes, and I've been an emergency medicine physician for over 3 decades. In that time, I've treated more than 10,000 seniors in acute crisis situations, and I've seen the same patterns repeat hundreds of times. The pattern I'm talking about today, it took me almost 20 years to recognize it because it contradicted everything I'd been taught in medical school. Before we go further, quick favor. I get messages from people who've watched 5 or 6 of these videos and didn't realize they weren't subscribed. Could you check right now? Just look below the video. If you're not subscribed, hit that button. It's free, takes 2 seconds, and it helps this information reach people who need it most. Here's what I'm going to show you. First, exactly what happens to your blood vessels after age 65, and why that changes everything about blood pressure targets. Second, the actual research that most doctors haven't read, including a massive study that tracked over 2,500 seniors and found results that directly contradict the standard guidelines. Third, the specific numbers you need to know, when to worry, and how to talk to your doctor about this. Here's why this matters specifically after 70. Your blood vessels stiffen. That's not a disease. That's normal aging. And when your vessels are stiffer, your body needs slightly higher pressure to push blood to your brain when you stand up. Push that pressure too low with aggressive medication, and you're setting yourself up for exactly the emergencies I see every week. Picture this scenario. You're 74 years old. Your blood pressure was running around 145/85 for years. You felt fine. Good energy, clear thinking, active life. Then at your annual checkup, your doctor says those numbers are too high. New guidelines say we need to get you under 130. Better yet, under 120. So, you start medication, maybe increase the dose of what you're already taking. Within a few weeks, something changes. You feel lightheaded when you stand up. You're more tired in the afternoons. Your thinking feels foggy. You mention it to your doctor. They say your body is adjusting. Give it time. Your blood pressure is now 122/78. Perfect, right? 3 months later, you stand up from the dinner table and the room spins. You reach for the chair, you miss, you go down hard. Hip fracture, surgery, rehab, loss of independence, all from a fall that happened because your blood pressure medication was doing exactly what it was supposed to do. I've seen this exact sequence at least 300 times in my career. The details change, but the pattern doesn't. Here's what makes this especially frustrating. That fall gets blamed on aging, or osteoporosis, or not being careful. Nobody connects it back to the blood pressure medication that was lowered 6 months earlier. After age 70, your cardiovascular system operates differently than it did at 50. Your blood vessels are stiffer. Your baroreceptors, the sensors that regulate blood pressure when you change position, respond more slowly. Your kidneys process medications differently. Your brain requires slightly higher pressure to maintain adequate blood flow. None of this is disease. This is normal human aging. But the guidelines, they're largely based on studies that either excluded people over 75 or didn't separate out the oldest participants when analyzing results. So we're treating 80-year-olds with targets designed for 55-year-olds and wondering why they keep ending up in my emergency department. Let me explain what's actually happening inside your body. Your heart pumps blood through your arteries with every beat. That creates pressure against your arterial walls. The top number, systolic, is the pressure when your heart contracts. The bottom number, diastolic, is the pressure when your heart relaxes between beats. When you're younger, your arteries are elastic. Think of them like new rubber bands. They expand when blood surges through, then bounce back. This elasticity cushions the pressure and protects your organs. After age 60, and especially after 70, your arteries stiffen. It's like those rubber bands have been sitting in a drawer for 20 years. They've lost their stretch. Now they're more like rigid tubes. When blood surges through a rigid tube, the pressure reading goes up. But here's the critical part. That higher pressure isn't necessarily damaging your arteries more. The higher pressure is actually necessary to push blood through that less flexible system. Now add gravity to the equation. When you stand up, gravity pulls blood toward your legs. Your body has to immediately compensate by constricting blood vessels in your legs and increasing heart rate to keep blood flowing to your brain. This system relies on sensors called baroreceptors in your neck and chest. In a younger person, this happens almost instantly. After 70, those baroreceptors slow down. They still work, but they respond in 5 or 6 seconds instead of 1 or 2 seconds. If your blood pressure is running at 145/85, there's enough buffer. When you stand up, pressure might drop temporarily to 130 or 135, but there's still adequate flow to your brain. But if we've medicated you down to 120/75, when you stand and that pressure drops temporarily to 105 or 110, your brain isn't getting enough blood for those critical few seconds. That's when the room spins. That's when you fall. Here's another piece most people don't understand. Your brain sits about 12 inches above your heart. Getting blood up to your brain against gravity requires pressure. It's simple physics. Think of it like a water fountain in a park. The fountain needs certain water pressure to shoot water up to the top tier. If the water pressure is too low, the water never makes it to the top. Your brain is that top tier. After 70, you need slightly higher pressure in the pipes. Reduced brain blood flow means less oxygen to your brain. Less oxygen means brain cells don't function optimally. Over time, that contributes to cognitive decline that everyone dismisses as just getting older. Now here's where it gets interesting. I'm not telling you to ignore high blood pressure. Severely elevated blood pressure, we're talking 180, 190, 200 and above, absolutely increases stroke risk even in older adults. But there's a sweet spot for people over 70, and it's not the same sweet spot as for younger people. Let me give you the specific numbers based on what the research actually shows and what I've observed in thousands of patients. If you're between 70 and 80 years old, a systolic blood pressure between 130 and 150 appears to be protective, not harmful. Protective. Below 130, you're increasing your risk of falls, dizziness, fatigue, and cognitive issues. Above 150 consistently, you're increasing stroke risk and heart strain. But that middle zone, 130 to 150, that's where I see people thriving. Here's the protocol I wish every doctor would follow for patients over 70. Step 1. Take blood pressure in 3 positions. Sitting after 5 minutes of rest. Standing immediately. Standing after 3 minutes. If there's more than a 20-point drop when standing, your baseline pressure may already be too low. Step 2. Assess symptoms, not just numbers. Are you dizzy, fatigued? Is your thinking foggy? Are you falling or nearly falling? These symptoms matter more than hitting an arbitrary number target. Step 3. Consider your individual factors. Do you have diabetes, prior stroke, chronic kidney disease? These conditions change the calculation. But if you're otherwise healthy at 75, you have more flexibility. Step 4. If you're on blood pressure medication and experiencing dizziness, fatigue, or falls, talk to your doctor about reducing the dose or eliminating medications. Step 5. Monitor your blood pressure at home. Same time each day. Sitting position. 5 minutes of rest first. Track the numbers. Look for patterns. A single high reading means nothing. Consistent patterns mean everything. Let me tell you something most doctors don't have time to explain. Blood pressure naturally varies throughout the day. It's lower at night, higher in the morning. It goes up with stress, activity, even a full bladder. A reading of 145 at the doctor's office when you're anxious might be 130 at home when you're relaxed. White coat hypertension, blood pressure that spikes in medical settings, is incredibly common in seniors. I've seen people put on medication based entirely on elevated readings at the doctor's office when their home readings were completely normal. Now, what about natural approaches? Salt reduction matters, but maybe not how you think. If you're salt sensitive, about 50% of people with high blood pressure are. Reducing sodium from 3,500 milligrams per day down to 2,000 to 2,300 milligrams can lower blood pressure by 5 to 10 points. That might be all you need. Potassium matters more than most people realize. Low potassium makes blood pressure harder to control. Bananas, potatoes with skin, avocados, leafy greens. If you're on certain blood pressure medications, though, you need to be careful. Talk to your doctor about the right balance. Movement is medicine. 30 minutes of walking most days lowers blood pressure by about 5 to 8 points on average. It also improves the elasticity of your arteries, actually makes them more flexible. But here's what I wish someone had told me 20 years into my career. For most healthy people over 70, the best intervention isn't adding more medications to push blood pressure lower and lower. It's finding the right balance where your blood pressure is controlled enough to prevent stroke, but not so low that it's causing daily symptoms and increasing fall risk. Let me show you what the science actually says. A 2018 study published in JAMA Internal Medicine followed 2,512 people over age 75 for 3 years. They looked at intensive blood pressure treatment, getting people below 120 systolic, versus standard treatment, which targeted below 140. What they found shocked researchers. The intensive treatment group had a 27% higher risk of acute kidney injury. They had significantly more electrolyte abnormalities. They had more episodes of dangerous hypotension. And here's the kicker. The mortality benefit that showed up in younger patients, it disappeared in patients over 75. There was no survival advantage to the more aggressive treatment. Another study from The Lancet in 2017 analyzed data from over 11,000 patients across multiple trials. They found that in patients over 80, treating to lower targets didn't reduce mortality and increase the risk of serious adverse events. But wait until you hear this next part. A 2019 study in the European Heart Journal looked specifically at blood pressure and cognitive function in seniors. They followed 1,270 people over age 70 for 5 years. The people with systolic blood pressure between 130 and 145 had the lowest rate of cognitive decline. The people whose pressure was treated down below 125, they had accelerated cognitive decline compared to the middle group. The researchers' conclusion, overly aggressive blood pressure lowering in elderly patients may compromise cerebral perfusion and contribute to cognitive impairment. Let me say that in plain English. Getting your blood pressure too low might be contributing to dementia. A 2020 meta-analysis in the Journal of the American Geriatric Society looked at 17 different trials involving elderly patients. Their conclusion? In adults over 75, treating to systolic blood pressure targets below 130 may cause more harm than benefit in those without prior cardiovascular disease. Here's the uncomfortable truth. The evidence for aggressive blood pressure lowering in healthy people over 75 is weak. The evidence for harm from overly aggressive treatment is strong. But the guidelines don't clearly distinguish between a 55-year-old and an 85-year-old. They give one target for everyone, with maybe a footnote about individualizing care in the elderly. That footnote? Most doctors miss it in the day-to-day rush of practice. Let me tell you the mistakes I see over and over. Mistake number 1. Treating the number instead of the patient. Your doctor sees 140 over 88 and the guideline says that's too high, so they add medication. But nobody asks how you feel. Nobody checks your blood pressure standing up. The number becomes the target and you become secondary. Mistake number 2, never reassessing medication as you age. You were put on blood pressure medication at age 65 when your pressure was 170 over 95. Now you're 78. You've lost weight, you're more active, but you're still on the same dose. Result? Your pressure is now 115 over 70, and you're dizzy every time you stand up. Mistake number 3, ignoring medication side effects. You tell your doctor you're tired all the time. They order blood work. Everything's fine. So they tell you it's just aging. Nobody connects your fatigue to the fact that your blood pressure medication has your pressure running 110 over 65. Mistake number 4, not tracking your own data. Your doctor sees you for 15 minutes every few months. They make decisions based on 1 or 2 readings in a stressful medical environment. If you're not tracking your blood pressure at home and tracking your symptoms, you're missing crucial data. Blood pressure management after 70 isn't about hitting a perfect number. It's about balance. Control high enough to prevent stroke, not so aggressive that it causes daily symptoms and increases fall risk. The research is clear. In people over 70, especially over 75, aggressive blood pressure lowering to targets below 130 can cause more harm than benefit. This isn't speculation. This is published data from prestigious journals analyzing thousands of patients. Here's exactly what to do. First, if you're over 70 and on blood pressure medication, have your blood pressure checked in 3 positions: sitting, immediately upon standing, and after standing for 3 minutes. If it drops more than 20 points when you stand, talk to your doctor about whether your medication needs adjustment. Second, track your symptoms. Dizziness, fatigue, brain fog, near falls, these matter more than hitting an arbitrary target number. Third, monitor your blood pressure at home, same time daily, sitting position, after 5 minutes of rest. Look for patterns over weeks. Share this data with your doctor. Fourth, ask your doctor about the right blood pressure target for your specific situation. If you're otherwise healthy and over 75, a systolic pressure between 130 and 150 may be more appropriate than pushing toward 120. Here's your timeline. If you and your doctor decide to reduce blood pressure medication, you'll likely notice changes within a few weeks. Energy often returns first. Dizziness when standing typically improves within 2 to 3 weeks. Mental clarity can take 4 to 6 weeks, but most people notice significant improvement by 2 months. Important safety reminder: never stop or reduce blood pressure medication on your own. These medications need to be tapered carefully under medical supervision. Stopping suddenly can cause dangerous blood pressure spikes. If you have a history of stroke, heart attack, chronic kidney disease, or diabetes, you may need tighter blood pressure control than I've discussed here. This video is about otherwise healthy seniors. You have more control over your health outcomes than you've been told. The patients I've seen maintain their independence well into their 80s and 90s weren't genetically superior. They paid attention to their bodies. They advocated for themselves. They found the right balance between treating real disease and over-medicalizing normal aging. If you found this helpful, subscribe and hit like right now. Help this channel reach people who need this information. In the next video, I'm covering the 3 medications that cause falls in seniors, including one that almost every doctor prescribes without mentioning the fall risk. Comment below with your current blood pressure numbers and your age. Tell me if you're experiencing any of the symptoms we discussed. I read every comment, and your questions shape what I research next. Your health is worth understanding. Don't just accept what you're told. Ask questions. Track your data. Be an active participant in your care. That's how you stay independent. That's how you thrive. I'll see you in the next video.